monitor the chat. And so I won't be monitoring the chat, but if you would like to ask a question but don't want to ask that yourself, feel happy to put something in the chat, and Hannah will kind of read out any questions at the end. And also, just to let you know, you'll receive a link to the presentation and a recording and some accompanying guidance, and that will be after the second webinar, because I'm doing a repeat of this webinar at the same time next week. Just mentioned Hannah. Say hi, Hannah. Hannah's done the design and tech support for this project. She's been brilliant, so I added her details if anybody needed some support. And I'd also like to say thanks to the Winston Churchill Memorial Trust. If you've never heard of Churchill Fellowships, I would really recommend looking up their website. They provide grants for people to travel across the world to research an area of interest to them. Really brilliant organisation. Okay, I'm going to move on and say a little bit about me. So just before lockdown, I decided to take redundancy from an organisation where I'd been Director of Advocacy for over 17 years. And I really wanted to kind of start doing some freelance consultancy work about LGBTQ plus communities, and generally around equity, diversity and inclusion, which is my passion. Since then, I've done things like equality audits of services, lots of training, and I've also been doing external professional supervision and executive coaching within both the advocacy sector and within the charitable sector. I mentioned before about Churchill Fellowship. 4 years ago, I was awarded a grant, and I went to Canada, to Toronto and Montreal, and Australia, Sydney and Melbourne, to look at what they were doing about LGBTQ plus health inequalities. Had an absolutely amazing time. Came back and wrote a report, and the link to the report, it will be in the guidance that you'll receive after the webinar. That's all my contact details. Please feel free to contact me if you want to. Okay, so what am I going to talk about in this webinar? I want to talk about why we need LGBTQ plus affirming services during and post-COVID. I'm going to also talk about what has been the impact of COVID-19 on LGBTQ communities, and also about different communities within the LGBTQ plus communities and how they've been impacted as well. I'm going to talk about the mental health needs of the LGBTQ plus communities, some research, but also some kind of analysis of what's why people are kind of experiencing mental health issues. And then, so that basically is about what's been happening for the LGBTQ communities around COVID. But then I'm going to move on to talk about how, as organisations can become competent in providing culturally sensitive, safe and affirming approaches for LGBTQ people. And then some tips on how you personally can be an ally. So I'm hoping to cover all of that in 40 minutes plus. Okay. So I'm going to start with talking about language. A lot of people say to me, oh, the LGBTQ alphabet, it's tricky to remember who it all is and what it's for. So just to kind of reiterate, LGBTQ plus stands for lesbians, gay men, bisexuals, trans or transgender or gender diverse people, queer or questioning people, and the plus is for people who don't identify as either heterosexual or kind of non-trans, and sometimes called cisgender, or queer, but they do identify as kind of outside of that norm, but not one of those particular letters. I don't know whether people will have noticed there's a lot of kind of the acronym has had I added to it more recently in the UK. I decided not to include the I in around this webinar on guidance, not because I'm not an intersex ally, but because I think it would be wrong to just add a kind of I in as an empty gesture when this webinar doesn't address any of the issues for intersex people. I also will be using trans and non-binary inclusive language. And I'll be referring to the LGBTQ plus communities rather than just one community, because each of the letters has its own kind of unique community, and we come together around tackling discrimination around homobiphobia and transphobia, and working together around that. But we do have each of us have unique distinct communities. Lastly, I'm using the term minoritized communities, not minority groups, and that is to signify that if all the minority groups were added together, they would be in the majority, but also that being minoritized is something that is done to other people. So it's about not being part of society's dominant norms, and then being seen as different and other and somehow less. And that happens to people. It's not something that they are innately. So those are some of the terms that I will be using. In the guidance, there is some, there's kind of a glossary of terms, so people will be able to see some of that in more detail. So why am I talking about LGBTQ plus affirming services? I think there's a lot of research and there's a lot of evidence that LGBTQ plus communities are, well before COVID, were underserved in health and care. And a lot of that comes down to this issue about people feeling that they want to treat everyone equally. And, you know, we don't discriminate here, everyone's equal here. But actually, the right approach would be to look at people as individuals and see what their needs are, and look at groups of individuals and see what specific needs and support that they need, what kind of barriers they have to accessing services, and kind of what happens in practice that kind of stops people from getting involved in services. I also often hear people say there aren't oh, we don't have any LGBTQ people in our services, and I guess that might be because there have been barriers, and you need to make sure that you're providing some kind of indication that your services are open and welcoming and friendly to LGBT people, because historically people have had bad experiences, or kind of have felt that they've been discriminated against, and they need to outwardly see that will be their default position. They need to outwardly see that services are kind of working towards kind of affirming their identity. I'm going to talk a little bit more about why LGBTQ plus people are affected by COVID, why that could be different from the general population. And then I'm going to talk about why it might be important to make sure that services kind of take account of equality during the pandemic, when perhaps they might feel they don't have time to do their kind of ordinary day job on top of thinking about equality. And then and similarly, I want to think about how it is important that we advocate for all equity and diversity issues post-pandemic, but particularly LGBTQ plus, because there will be the services, there will be increased demand for services, they will be affected by less funding, and those are the times when you know, it's likely that the gains that we've made around equality will be eroded. So we'll need to be making sure that the agenda of equality and rights is still kind of on the table. So I guess some people might be thinking, well, I haven't heard anything in the news about you know, LGBTQ plus people being affected worse by COVID, and you know, I haven't seen any information about that. Partly that's because of lack of data. Traditionally, services haven't monitored well around LGBTQ plus people, and they won't necessarily know how many people who identify as LGBTQ plus. But there has been some evidence coming from the US and also from community organisations that people are being adversely affected. So one of the reasons is that people are more likely to be living in higher risk circumstances. So they may be affected by poverty, they may have unstable housing, they may have more unstable work, or be in high risk jobs where they're less likely to be able to work from home, and also more likely to live in socially deprived areas. And those are some of the high risk circumstances for contracting COVID. But also that personally, they're more likely to have high risk health factors resulting in more severe symptoms if they do catch COVID. So for example, LGBTQ people are more likely to smoke, use alcohol and drugs, and more likely to have weight issues, and that can affect symptoms. But even if people haven't, and also there's a high risk of developing long COVID, and that's because there's a higher likelihood of getting long COVID if you have high levels of stress, if your immune system's lower, or if you have had chronic stress. And I'll talk more about the impact of that when I talk about mental health needs. But also, if people haven't directly been affected by COVID, there's been a huge impact of lockdown restrictions on LGBTQ plus communities. We're more likely to, our networks less likely to be in our neighbourhood. We're more likely to have extended networks rather than small clusters that can easily be in a social bubble. You know, a lot of people rely on kind of pub and club culture and kind of other networks which they haven't been able to access. And then because of the circumstances that I was talking about before, about people feeling that they're worried that they may be discriminated against in services, they're less likely to seek help on time or early. And it's not the same for all parts of the LGBTQ plus community. So there are some people who are affected worse than others. Young LGBTQ people may be living in or have had to return to more hostile families of origin. So living at home where they're not out or their family aren't approving or supportive. But in terms of homelessness, there's a high proportion of young homeless people are LGBTQ plus. And also the impact of education and employment. So if you haven't got a particularly supportive home environment, often being at school or at university has been the only place where you've been able to get support. And similarly, if you were in employment but you were furloughed or you've been made unemployed, and more likely to be spending more time in the home. And I think even if you've had a supportive family environment, young people are more likely to rely on peer support outside the home, and that has been severely restricted. So for racialized LGBTQ plus people, we know, we've seen in the press that there's been a higher incidence and worse outcomes for catching once you've caught COVID-19, but also there's been impact of discrimination and a hostile environment, and that has been particularly evident over the past 18 months with the deaths of George Floyd, with Black Lives Matters, and also the hostile environment around immigration, which is particularly affecting refugees and asylum seekers from within the LGBTQ plus community. For people who identify as trans or gender diverse, similarly, there's been the impact of a hostile environment. There's been a lot of kind of negative press and campaigns on social media, which have resulted in discrimination towards gender diverse and trans people. But also in terms of gender affirming services, there were massive delays before COVID. You know, some people could be waiting 5 years to receive a service, and that can have a huge impact in terms of the mental health of people who perhaps had a date for surgery and that surgery's been cancelled. Continuing, for older people and disabled people who are LGBTQ plus, we know there's been a higher risk of catching COVID. There's been huge issues around isolation and what the impact that's had for people, and particularly as similar to what I was saying for younger people, if your networks have been outside your local community. And then there's also the issue about those who use health and care services. There's been, you know, reduced services as kind of services and staff have been diverted to the kind of more emergency side of things. We've heard of lots of people having kind of routine services cancelled, you know, whole staff teams coming down with COVID, so they've not had access to services, and that's been affecting people's lives. And then finally, LGBTQ plus families. I mentioned before about people feeling that social bubbles and the way that lockdown was organised was more difficult for the LGBT community. But I think for people who have chosen families rather than biological families, that hasn't really been recognised as part of the kind of restrictions. And so it's left people feeling increasingly isolated and invisible. So I'm now going to talk about the mental health needs of LGBTQ plus people. So amazingly, there's been 2 pieces of research have happened in 2020 during the lockdown. LGBT Foundation wrote a report called Hidden Figures, and that stated that 42% of the respondents would like to access mental health support. It didn't say that they were accessing it, it was that they would like to. And I don't know whether that means that there wasn't the support available or they didn't feel confident enough to. And 8% said they didn't feel safe where they were currently staying. University of Central London and Sussex University also did a survey, and that's highlighted that there's a potential mental health crisis among LGBTQ plus communities, with 69% of respondents suffering depressive symptoms, and that rose to almost 90% if people had experienced homophobia and transphobia during the pandemic. So those incidences of homophobia and transphobia have been on the increase. So I want to talk about minority stress. So minority stress is about when people suffer distress as a result of belonging to minoritized communities. And that can be around discrimination, but also in terms of trauma. So some of the stresses around that can be, as I was saying before, homophobic, biphobic, transphobic culture, being harassed, discrimination and victimization. But some of it is a bit more insidious than that. So it's about the stress of hypervigilance. So, you know, I'm sure you all know the example of people who aren't heterosexual or kind of aren't trans or are kind of less likely to hold hands with their partner all of the time in public. They, you know, when you do hold hands in public, you do have to be vigilant about where you are and make a decision to do that. And also people often talk about, oh, when did you come out? But actually we come out all of the time, and we're constantly making decisions about when it's safe or when we can be bothered to mention that our partner is the same sex, or kind of that we're not kind of part of a traditional setup. And then also code switching, it can be stressful, and this is where you aren't able to be your whole self in different situations. So you might, for example, might not be out at work, and you have to have a different identity at work than you do have at home or in communities that you feel safe in. Or it might be just that even though you're out, that you have a slightly different toned down identity in certain environments, you know, where you want to not be too gay or kind of too trans or out there. And that can be stressful, switching from different identities. Yeah, so it can range from small microaggressions right through to hate crime. So a small microaggression might be something like somebody who knows that you're kind of in a romantic relationship with a partner, but consistently doesn't call your partner by their name or by saying partner, but refers to them as your friend, which will be irritating, but those kind of irritations really build up over periods of time, right through to experiences where people have been violently attacked, and it's been obvious that it's been a homophobic, biphobic or transphobic crime. And I was just talking there about the kind of incremental trauma that happens across a lifetime, and that can be very, the build-up of that can be very similar to post-traumatic stress disorder. And then just to be clear, what I'm saying is that mental health is not because of the person's LGBTQ plus identity. So you don't have mental health problems because you're a lesbian or gay man, for example, but it's because how you are treated and discriminated against in society. So I've kind of described what the situation is around kind of how COVID's been for LGBT people, but I felt like it would be really important to talk about what we can do differently moving forward. So I wanted to talk about using a different approach to health and care. And I mentioned before about traditionally people have talked about equality being we don't discriminate against people, we treat everyone the same. And the importance about this is that we aren't all the same, we're all unique people, but there are some common factors in terms of the discrimination and inequality factors around LGBTQ plus people. So some of the things that we might use to make sure that our services are affirming LGBTQ plus identities is making sure that we understand the what the Equality Act says in terms of protecting LGBTQ people against discrimination. A lot of people think about the Equality Act in terms of employment, but actually it also covers delivery of services as well. As organisations, people need to look at their policies and procedures and make sure that they are culturally safe and sensitive, but also make sure that there's no unintentional discrimination across all their policies and procedures. So this is not just about developing an equality or equity, diversity and inclusion policy and feeling that's wrapped up and done. It's about making sure that all of your policies reflect your values in terms of being non-discriminatory. I talked before about the importance of gathering data. Data needs to be gathered sensitively, but you know, the time has passed when people would consider asking somebody about their sexuality or gender is a private matter and too embarrassing to talk about. We want to be visible, and the way to be visible is to be counted, and it has to be done sensitively and confidentially, but also there's no point in gathering this information if it's not being used properly, analysed and used to look at improvements that you can make in terms of who's accessing your service, where are the gaps. And then talking about improvements, there needs to be a clear action plan developed as part of the organisation's strategic planning, needs to be integrated into the whole organisation. Images and promotional kind of activities are really important, as I said before, because of people's history, you know, and historically LGBTQ people have not been treated well by services and systems. It's not that long since homosexuality was taken out of the definition as part of being part of a mental health condition and treated as a disease. So it's really important to counter that by having visibility through images, but also I think in terms of having sensitive and safe approaches, it's important to look at training, both about inclusive language and focusing on trauma and making sure that your services don't re-traumatize people and that your practices are trauma informed. Also looking at when you are working with a specific group of people, it might be important to have training on the issues that LGBTQ people might face within that client group. For example, the issues might be different between older people and younger people. There might be specific issues for mental health, cancer care, end-of-life care, for example. It's also important as an organisation to engage with local communities. You may have staff networks who are linked to those communities, but also you need to make sure that the staff networks are linked to any decision-making systems, so they can affect change. Also, contacting local support groups and community groups to see what they identify as their needs and what responses they think are appropriate. If you live in a rural kind of setting, it would be really important to make sure that you have comprehensive competence across the organisations. And but if you live in a larger city, it might be important to look at whether there are specific LGBTQ services needed. If there are some available already, how you link into those, and what you can do to support community organisations to develop services that are LGBTQ plus led. And also it's important to think about supporting local LGBTQ plus community organisations all the year round, not just on Pride Month. So lastly, I want to talk about what you can do to be an LGBTQ plus ally. So you may want to stand alongside us. So standing alongside us can be supporting someone, kind of listening carefully without any preconceived ideas to someone's experience from their point of view, standing by them through a difficult experience. You might also need to stand in front of us, and that might be if you need to protect someone from harm. But also you can stand behind us by supporting us through us being able to express our lived experience as experts who know what's best for us as well. So not taking over. So actions you can take as an ally. You could educate yourself. You can use the internet. There's some great resources out there. It's important to get a balance between things that you find out on the internet and what might be personal to an individual. So, you know, you don't want to stereotype people, but neither do you want to make somebody from the LGBT community do all the work in educating you, because that can be exhausting. So if you can, and you're not part of the LGBT community and you're going to be working with some group of people, try and educate yourself first. Understand what privileges you have personally. You may belong to one minoritized community, but you may have privileges in other areas of your life. Privileges being unearned benefits that you take for granted. And so understanding what privileges you have and how can help you understand how you see and view the world, and how others may be in different positions from that. Of course, be respectful and kind. But if you do make a mistake, be able to say sorry, and by being sorry, that also means that you will make a change. But also don't make that into a situation where the person that you're apologizing to has to do all the work to kind of put it right for you. If you have some issues around that, you know, the most important thing is to say a simple sorry and move on. And then if you need to do some discussion about that, then use kind of work with another ally, somebody who isn't from the LGBT community who has more understanding to support you in that. It's important to influence others. If you have information. It's much better for the LGBT community if people who are allies advocate for our rights than us constantly having to do that for ourselves. And also be an active witness if you see any discrimination, you know, within your organization or in other places, or if you see, even if you see a hate crime, you can report a hate crime, you know, even on public transport as a witness. You don't have to be the victim. You can make that report, and that is kind of important. Also, if you are, if you experience any homophobia, or biphobia, or transphobia, that is still considered a hate crime, even if you do not belong to that community. So that can also be reported. So, you know, if somebody calls you a dyke and you're not one, that's still a hate crime. So for those of us who belong to LGBTQ plus communities, I think it's also important to remember that we need to act as an ally to those in other communities, and also to those who are within our LGBTQ plus communities. And just lastly to say, as an ally, no matter how small the action that you take might seem to you, it can make a big difference to someone, especially for people who have spent a lifetime feeling excluded and discriminated against. So that is me. So thank you very much. I'm going to stop sharing now and see your faces. Hello, everyone. So, Hannah, I don't know if there's been any comments or questions in the chat. If
let me just check. There's been no comment in the chat as of yet. But if anyone wants to put it in, if they don't want to say it out loud, I'll happily read it out for you, or you can unmute your microphone and ask a question.
Yeah, so does anybody have comments or questions? Oh, I see Jack has a comment. On you go, Jack.
No, it was would be from me. Just to unpack some of the stuff you were saying about essentially cultural competence. I think one observation is what I would call the rise of the rainbow lanyard, which is where things have got to a point where there's a broad acceptance organisationally from, say, NHS bodies or many VCSE organisations. But scratching below the surface of acceptance, you find yourself in a situation where someone has absolutely no idea of what your life is actually like, or how your life has been different. I think more profoundly, when you've got people with LGBT lives that are different from essentially heteronormative ones, and things that could be quite shocking. A lack of understanding of where to go with that. And actually, I'll give a personal example of working with some of, I did a bit of volunteering with some of the local substance misuse services, and they were all draped in the rainbow lanyards. But actually, when I started talking to them about gay men and chemsex and the situation that developed, there was just, oh, I don't know anything about that. Nothing. And I went back several months later and was like, no, I still don't know anything about that. That's partly about the way the service is commissioned, but that kind of, it's very galling when you've got all the symbols of allyship and you divulge to a service in that sort of situation and they say, oh, no, I don't even know what that is. And so I do think that there's a step beyond the standard EDI training that's available at the moment, which actually is around cultural competence and lives that are possibly shocking and totally alien, particularly around things like mental health services, substance misuse. Jacqui mentioned levels and types and patterns of substance misuse are woven into a lot of LGBT people's lives, and the impact is considerably serious, but there is nothing that is appropriate. However, those organisations will have a Pride Month rainbow logo, but nothing to back it up other than, oh, we're open to everybody, but we've no idea what you're talking about. And you're not one of the nice gays that I know, because you wouldn't take me to the drag show, because I love just finally years ago I did a radio show with Simon, a TV show with Simon Bates of Phoning, and a woman from Liverpool phoned in, and she was doing, well, I love the gays, they're so much fun, they wear bright colours. And I was really stony faced and said, right, well, I'm miserable as sin and wear dull coloured clothes, but I still demand the right to be respected. And that was totally shocking in that context. So yeah,
you're
it's
right, Jack, in terms of that whole issue about that if people are going to demonstrate that they are LGBT friendly or allies, that they need to back that up with action. And that was, you know, some of the things that I was talking about comprehensive kind of training, both on kind of how to be culturally competent and balancing that issue between having some knowledge about LGBT lives, but also being able to flex that in terms of people being individuals and kind of having their own experiences and being able to feel confident enough to ask people about their own experiences. But also, I think, making sure that the kind of changes that need to happen need to be kind of consistent and need to be through the whole organization, you know, and also not just kind of left to the LGBTQ people within the organization. I heard somebody the other day say that a gay man that I was talking to said he's got his day job and his gay job. So, you know, and that can be a pressure in itself, having to kind of be the lead in your organization because you have some knowledge. So it's important that allies can take some of that weight as well.
We have quite a few people agreeing in the chat about this, about what we just discussed. So that's good to hear.
Yeah, I think so. I think Sophie was talking from LGBT Foundation that a lot of people do have really negative experiences of mainstream support. And I think a lot of people are quite shocked by that because they, you know, genuinely feel that I don't, you know, my organisation wouldn't be like that, surely, you know. But there is some evidence to say that in the NHS, over 50% of NHS staff have heard homophobic and transphobic slurs from colleagues. And also there was some research done recently where I think it was, I can't remember the figure, but it was a high percentage of NHS staff said that there didn't need to be anything more done for LGBTQ people now. So yeah, I don't know, Sophie, you're smiling. I don't know if there's anything else you want to add to that.
No, sorry, I've got a bit of a cough. My role is actually overseeing support services for LGBT people, and this was funnily enough shared by colleagues within the NHS service saying, oh, I think you should attend this, and I was like, definitely, I think we all should. But yeah, I think from service users' point of view, they talk a lot about seeing people with rainbow lanyards, seeing it on the website, but getting there, and then, for example, with domestic abuse, being told like, it's not domestic abuse, it's just like a cat fight, or like loads of different examples of what people see, or like two men fighting, oh, it's just two men having a fight, it's not domestic abuse in the community, like, oh, your mental health's worse, that's bad, like, but we can just offer you the same thing. I mean, I think that's why our referral rates have gone through the roof. I mean, we're seeing more people now than we ever have, and I think you bang on with all of the stuff that you spoke about in training. It's just nice to hear somebody else say it instead of it just being one place saying it. So thank you for having this space. I think it's useful for a lot of people here, and a lot of LGBT communities coming together as well to hear this and be like validated within that.
Yeah, it's important. Thank you. I think, you know, so examples of kind of a kind of discrimination, you know, just to be clear, so I have personal experience of my partner not being allowed to visit me when I was having surgery because it was partners only. I had experience when my child was in hospital, where a nurse a doctor actually in front of my children said that they surely must have a dad because all children had a dad. You know, so there's kind of, and I had to very clearly say, this is my partner. We've had our children together, and they have a sperm donor. But you shouldn't have to go into that whole detail, things like that. I know people who've had kind of cancer, end of life services where their partners haven't been treated the same way as kind of a heterosexual partnership would do. And I think you're right also, Sophie, about domestic violence. You know, domestic violence happens either to the same degree or slightly more within the LGBTQ communities because of the stress people are under, and often the services really don't know how to handle that at all. Has anybody else got any questions or comments they want to make? Yes, MW.
Yes, it's Maggie. I work in the Western Isles, and living and working in such a remote and rural area, it's really difficult to consider separate services for people with a whole mix of issues, not just LGBTQI. I think trauma-informed practice has to be the way forward. And I really am struggling to understand why we don't do that for everybody. Yeah. And when I have challenged it, particularly for maternity services, I got, well, not all women need it. So how do you identify who needs it and who doesn't need it unless you do it universally? So I think that's one element that I'd like some comments on. And the other is about the toxicity of social media. And I got involved because, well, I didn't get involved. I got posted something by somebody who was talking about one of my children who's gay, and wanting to know why and what condition did they have that made them that way. And I was just thinking, this is none of your business. And I don't use social media. This just flagged up on an account that I have for the kids. So it was just really quite surprising to see, and the toxicity associated with it. And I just could not understand why people feel it's all right to do that, but they wouldn't do it to my face.
And also, I think, Maggie, the impact of social media has been so much stronger during COVID, because people have been kind of in enclosed spaces, more, you know, relying on it as a lifeline, but also seeing lots more negativity. I kind of follow Jack on Twitter, and I think he posted something yesterday about England and the captain having a rainbow armband, and you know, just even posting something like that, which is positive. In the comments, there were hundreds and hundreds of negative kind of comments, and you know, obviously, as as an LGBTQ person, if you're sensible, you just don't go there. But you know, there will be people who have got sucked into that and then have started reading those things, and that's made them feel even worse. So you know, it's even just kind of and sometimes it, you know, particularly around the kind of issue around trans and gender diverse people are, you know, even people who are being positive towards that community often are coming in kind of getting lots of negative comments because of that. Jack.
I just wanted to do a little bounce back in defense of social media, because there are some positive aspects to it. And if I may, a pen portrait of a friend of mine, an acquaintance really, who had just turned 65 during lockdown, from Jackie's hometown, from Morpeth, but now lives in Newcastle now. the way he socializes is very much modeled on the way that gay men of perhaps a slightly older generation would have socialized, which would be going to the local pub, the local gay pub, where it is more comfortable for older men to go. He would go there. His kind of social networking would be, he doesn't necessarily know people's surnames. Often he just knows people by a nickname. He wouldn't arrange to meet people there. He would just sort of sit at the bar stool and hold court. So he didn't have people's phone numbers, but what he does have is a Facebook account and with various people's contacts in. And that had been a lifeline for him. And I had a conversation with him about, how come you don't have people's phone numbers? And it's because for a long time post Wolfenden, you didn't keep a phone book. You didn't keep all people's names, because if you got arrested, your phone book would be taken away from you and everybody who was in your contacts would be interrogated by the police. So social media, his Facebook, has actually kept him alive and been his sole contact through lockdown. So although there are lots of negatives, which I fully understand, if you listen to, basically social media allows us to see what a lot of unpleasant people spout a load of shite, but it does, however, allow you to have a degree of social contact. If you don't have the confidence and the social capital to actually ask for someone's phone number and do a one-to-one contact, and just I work supporting new and existing VCSE organisations, and what we've found is a number of essentially Facebook groups now coming to us to apply for CIO status, to create and fill gaps in the local LGBT plus VCSE that have stayed empty for a long time. So there are some positives around that, some real positives. That was a bit long-winded. I'm so sorry, Jacqui. How unlike.
No, I think you're right in terms of social media in particular. I think, I was talking about young people being in hostile environments. I guess social media and being able to externalize yourself, and have relationships with people outside your home is really important. But I think one of the things that hasn't happened very well around social media is about kind of the safety. And you talked before about drug and alcohol stuff and about sex, for LGBTQ people, it's a very hard message to hear in terms of kind of social restrictions. We've fought long and hard for kind of our kind of rights around our sexuality and the right to be sex positive. But there's not a lot of information about out there about how to be safe on the internet as well, for LGBTQ communities. So that's also an issue, I think.
We have a comment from Abby, who says the father of her son is bisexual and has quite a lot of issues with ignorance from both the straight community and the LGBTQ community. She doesn't know if it's because it's close to home, but she finds both in her personal and her professional life that biphobia is quite loud. People want to know if they're going to pick a side, and often when I'm filling in forms for people, the choices are only heterosexual, gay, lesbian, or prefer not to say.
Yeah, I think that is a really important issue. I think, particularly when I was talking about homophobia, I deliberately included biphobia on there. I think there is some evidence that actually bisexual people have the worst health outcomes because they suffer the discrimination, but they haven't got the support networks or the social capital around them, because they can be rejected by, like you say, by both the heterosexual community and the lesbian and gay community. And particularly, that was one of the things I was thinking about bisexuals, but also trans and gender diverse people, about talking about how those of us who are part of the LGBT community need to look after each other as well, and be allies to each other. And, you know, we're not all the same and we will have differences, but it's important to keep that level of respect and support for each other as well. Okay, I think it's 2 minutes to, unless anyone's got any burning questions that they've been dying to say something. I think that's probably a good place to leave it, I think. So thank you very much. It's been a brilliant turnout, and we will be kind of sending you out this information. Feel free to kind of pass the information on to other people, to create awareness. I'll be sending links out so you can kind of easily share those links with other people. Feel free to do so, and I hope you've enjoyed the session, and thanks very much for coming. Thank you. Thanks very much. Thanks. Thank you. Bye-bye, everyone. Hi, Lee. Oh, lots of thank yous. Hannah, is there a way that you can save the chat?